Hello, everyone. I'm Dr. Lisa Taylor-Swanson, and it's a real pleasure to talk with you today via the Headache School. I'm going to be speaking today regarding acupuncture and does it work for headaches or not? Just a brief little bit about myself. I'm an assistant professor here at the University of Utah in the College of Nursing, and I'm a clinician researcher in that I'm clinically trained with a master's degree in acupuncture and Chinese herbal medicine. I've practiced acupuncture for 22 years now with a specialty in women's health, treated a lot of people with headaches over the years. And then I'm a PhD prepared nursing scientist. So again, I'm a clinician researcher, and it's a real pleasure for me to bring both those skills to you today for this talk. So just a brief overview, I'm going to talk a bit about acupuncture. What is it? Does it hurt? Very common questions that I field. And then I'll talk just briefly about the evidence on acupuncture for headaches. So to start off, acupuncture is a tool that's used within the discipline of traditional East Asian medicine. We actually have literature that we read that's over 2,000 years old. And not only do we still read it, we still use it. It's clinically relevant all around the world, helps us to diagnose and to treat patients all the time. So it's really interesting to think about a tradition that's that old and still to the minute relevant to our lives today. And so many people will ask, okay, well, it's a time-tested, mother-approved, long-standing intervention, but you know, the needles, how big are they? Does it hurt? And so this image on the right, I think, is helpful. Needles that we used in acupuncture are very, very small, about 0.25 millimeters. So the first little image in the middle there, first to the left, and then to the right of that is a sewing needle that's about 1 millimeter in diameter. So it's a quarter of the diameter of a sewing needle. They're pretty darn fine, and it actually doesn't hurt. It's nothing like having a blood draw or a vaccination or immunization, because in those, of course, it's not a solid needle, it's something being taken out or put in. So typically, the technique that's used by most clinicians in the United States today is to use the acupuncture needle with a guide tube. And so what you'll first feel is the guide tube being pressed onto your skin. That kind of tricks your nerve endings. So you feel pressure, and then just tap in the acupuncture needle, and you might feel that insertion and you might not, to be honest. There might be a slight distension feeling or a sense of pressure, but it dissipates quickly. So it really is not a painful procedure. And to be honest, most of my patients either fall asleep on the table with the needles in place, or at least are very relaxed and always comfortable. So typical acupuncture treatment will consist of several things. First off, the clinician will ask you a lot of questions. We will ask you not only about your headaches, what type you have with a migraine or tension or cluster or so forth, for how long you've had them, the quality, is it the old ice pick feeling or vice on the head or whatever else. But we'll also ask you about your sleep and your mood and your digestion. If you're female, we'll ask you about your menstrual cycles. And that's not to be nosy. It is because acupuncture, the way we diagnose and treat each person is by understanding the whole person. One person with migraines who has diarrhea and another person with migraines who have menstrual cramps, the differential diagnosis that explains the whole person will be different. So that's why we ask about your whole medical history, not only your primary concern, which in this case, of course, is headaches. So after talking for a bit about your medical history, the acupuncturist will typically either give you a gown or instruct you, okay, pull your sleeves up or your pant legs up, have you get onto the table, dressed however they've indicated. They'll typically take your pulse at both wrists with 3 fingers. Now that is because we're assessing much information about the pulse, not only the rate, which is always checked, but also the quality, if it's a very strong, forceful pulse or very fine and minute. So after taking the pulses, we'll also use another old-fashioned diagnostic, which is to look at the tongue, the top and the bottom, and the color, the quality, whether there's prominent veins visible under the tongue. All of that information are other diagnostics that we use, much like the pulse. So your information that you talk about, along with your pulse and your tongue, all that information is triangulated by the acupuncturist to make your individualized differential diagnosis and treatment plan. So then they'll swab each area that's going to receive an acupuncture needle with alcohol to prepare the area, just like if you're having a blood draw or a vaccination. And then they'll insert the needles, make sure that you're comfortable. Typically, treatment rooms will have dimming lights. So you don't lay there on the table if you're face up with light blasting in your eyes. And they'll make sure you're comfortable, sometimes play music if you like that. And then leave you to rest anywhere between 20 to 40 minutes. Typically, especially the first treatment, they'll come back and check on you, make sure you're still comfortable. And when I'm on the table, usually I have this kind of dreamy, swimmy experience that a friend of mine called Aculand. And I think that's a very good term. It's like you just go off to Aculand, it's restful and relaxing, and then you kind of come back. And after the treatment, usually people are quite relaxed as well. So that's the nuts and bolts of an acupuncture treatment. Oh, and then of course the acupuncturist will come back, take your needles out, and let you know that you're fine to get dressed and go on your way, and send you off to reception and let you know when you should return. So again, that's the basic nuts and bolts of what an acupuncture treatment is like. Now, acupuncture and headache is a very well-researched and hot topic kind of area. I just put this screenshot up. It's a Harvard Medical School health blog about acupuncture for headache. So really, I'll just sum up my talk right now. And if you're in a hurry, you can push stop after this. The evidence is quite clear. Acupuncture is safe and effective. It's a great option for different types of headache. That's really the nuts and bolts of it. But I want to give you some details because we have the time to do that. And I have the expertise to help you out in that way. So I'm going to talk about migraine headache, both for adults and for peds, for kids, pediatrics, tension type headache, and also chronic headache. I will mention too, I use this picture. It's a AcuMan. We have these plastic dolls, you could say, with all the acupuncture points noted on the body. So the lines that you see are the acupuncture meridians, and the dots with little black bits of information, those are the names of the acupoints. So everywhere you see a circle is an acupoint. There's over 300 on the body. There's a lot of different places to choose from, basically, to deliver acupuncture. So first, looking at migraine among adults, this was published in 2017. You'll notice up at the top, this has been viewed over 36,000 times and is published in JAMA, one of our most reputable and well-respected medical journals. This is JAMA Internal Medicine. And this was a randomized clinical trial looking at the long-term effects. So they looked at acupuncture as it was being delivered. How were people's migraines? And then they looked for quite a ways after the intervention had ended. Did their migraines stay improved, basically? And so this was a study of almost 250 patients of adults with migraine without aura. And they found that acupuncture statistically significantly reduced frequency of migraine headache. Now, one interesting thing about this study is they had 3 arms: acupuncture, sham acupuncture, which is fake acupuncture. We're trying to have rigorous controlled studies. So of course, in a drug medication study, they'll have whatever drug, say Zoloft for depression, and a placebo. So here we have acupuncture and sham. And then the third arm was a waitlist control. So they were waiting to get acupuncture, having whatever usual care they might have anyway. And so acupuncture performed better than sham acupuncture, the fake acupuncture, and it performed better than waitlist control. Now, the dose is really important to look at. They delivered 4 weeks of acupuncture, followed by 20 weeks of follow-up. So again, they wanted to see 5 months out, are people still feeling better or not? And they were. Now, the other thing about the dose, though, is they gave acupuncture to the participants 5 days a week. Now, I'll tell you, I've been treating patients 22 years. I have not once treated a single patient 5 days a week, especially not for 4 weeks. Typically, it's too expensive here in the United States. The study was conducted in China, and people are too busy. If anything, I've very often delivered treatment twice a week. That's when people are really, really suffering. Symptoms are very severe. So I wouldn't anticipate in a clinic here in the US or in Europe, for that matter, that anyone would be receiving acupuncture 5 days a week, but very likely 2 days a week for migraine. So you could anticipate having some benefit, but maybe not in 4 weeks, like they saw in this study. Looking at pediatric migraine, it has a very promising safety profile among kids, among adults. It's very, very safe and well tolerated. This study was a narrative review. So they were looking at many other studies that were randomized controlled trials or a qualitative inquiry regarding acupuncture. And so looking at a bunch of acupuncture studies, they again found that acupuncture is effective to treat kids with migraine. Now, I'll mention briefly, as I noted in my intro, my area of expertise is women's health. What I've found often is I'm treating women in the midlife for menopausal transition symptoms, for headache, IBS, stress, you name it. They'll feel better and they'll say, oh, can I bring my kids in to see you? And I'll say, yes, of course. I've been trained to treat kids as well. And I will tell you that any acupuncturist who's treating kids, one, they love kids, they're going to be gentle, they're not going to scare them, and they're not going to traumatize them. Because typically when I've had patients who bring their children to see me, kids are really suffering. I mean, who thinks of acupuncture as the first intervention? Usually no one. It's usually we're desperate, we've tried everything else. And so in those cases, again, very often I've treated kids who have had lots of surgeries, lots of other interventions. The last thing I'm going to do is, again, to traumatize any little kid with needles that are scary. So it's going to be a safe treatment. It's going to be delivered in a very gentle, child-focused way by any acupuncturist who's treating kids. So don't worry. Tension type headache. Now, this is a very interesting study. It's a review of 8 systematic reviews. So a systematic review is reviewing other studies. And this is a review of 8 of those studying other studies. So long story short, it's a mountain of evidence. And they found that acupuncture statistically significantly reduces frequency and severity of tension type headaches. That's great news, right? Fewer headaches that are less awful, less severe. One limitation of this study, though, they did note that there was a real poor quality rating of a lot of the studies that were reviewed. So that's a challenge for sure. So it's always important when talking about scientific findings to note the actual results as well as any potential limitations, and that is one. Now, looking at chronic headache, this is a very important paper in my field. It was published in 2018. And it's another one of those review of other interventions, other RCTs, but it's what's called a meta-analysis. So they pooled all the data from 39 trials of acupuncture for chronic headache, osteoarthritis, shoulder pain, and musculoskeletal pain, or musculoskeletal, if you're from the UK. And they have again found that acupuncture was superior to sham acupuncture as well as no acupuncture or usual care for chronic headache. So it's a high, we have an evidence pyramid. The meta-analyses are the highest level of evidence, the most rigorous, the most convincing, and this really says it all. So again, for migraine, whether adults or kids, tension type headache or chronic headache, this acupuncture is a very good option. It's safe and effective. So you might be wondering, okay, well, Lisa's kind of convinced me. I'm curious about this now. How do I find a good acupuncturist? Well, like everybody does today, you can search online, you see how many stars people have, what kind of reviews, and ask your friends, ask your family members. You can even email and ask me. I'm happy to help you find somebody wonderful. But there's a few rules of thumb that you can keep in mind when you're searching and asking around. The most important is that all licensed acupuncturists are very well trained. We have either a master's degree, like I do, as I mentioned briefly at the onset, or a clinical doctorate degree, depending upon which school they studied at and when. When I went to school 22 years ago, there weren't any clinical doctorates to be had, to be pursued in the United States. Now there's a lot. So there's going to be either a master's or a doctorally prepared acupuncturist. And then they will have a state license. And here in the state of Utah, all acupuncturists are licensed, just like every other healthcare provider, through DOPL, the Department of Professional Licensing through the Department of Health. Now, in order for any acupuncturist to become licensed in any state in the United States, they have to pass a national board exam. So really, whenever you see someone online or hear about a friend or family member who's seeing a licensed acupuncturist, if they are a licensed acupuncturist, they've got a degree or 2 or 3, and they've been vetted by the State Department of Health, and they're nationally board certified. So really you can take confidence and comfort that you're going to find somebody wonderful who's very well trained. So I want to cover just a few more questions that I'm often asked about acupuncture in general. So what is the cost of an acupuncture treatment, and does my health insurance cover it? What about Medicare? So these are all interrelated questions. So here in the state of Utah, not very many insurance plans cover acupuncture. So call yours or go online, check your benefits. In the state of Washington, where I previously had a private practice for over 17 years, state law mandates that all medical insurance cover acupuncture in the state of Washington. So there I had a very large, probably 80% of my practice was insurance-based. But again, that's not the case here in Utah. Medicare recently added acupuncture for low back pain only. So they will pay for acupuncture for low back pain. So unfortunately, if you have low back pain and headache, you can get it billed for the low back pain aspect of that treatment. But they, again, only cover that one concern. We are actively lobbying to educate Congress regarding the efficacy and the safety of this medicine. Someday, I'm sure Medicare will cover acupuncture for other concerns, but not right now. Now, the cost, if you're paying out of pocket, really varies quite a bit. And that actually gets to the next question about what the difference is between individual and group acupuncture. So individual treatment is what you probably are used to having when you go see your physician or nurse practitioner. You're taken back to a treatment room and you have a one-on-one conversation and consultation. Same with a massage therapist or a chiropractor. And that is individual acupuncture treatment as well. So one-on-one. And that usually costs somewhere between about $60 on the low end and about $150 on the high end, depending upon where you are in the United States. Here in the Salt Lake Valley, I've seen rates that run between $60 and about $130 per treatment. And so that's, again, for individual care. And that, of course, adds up pretty quickly. So one terrific option that's a cost savings option is to go for group acupuncture. And so sometimes people have said to me, oh gosh, I'm not sure I'd be comfortable being, with a bunch of needles around a bunch of other people, but it's very comfortable and always, of course, discreet and appropriate. And so basically group acupuncture will be in a larger room. Typically they'll ask you to come once and have a one-on-one treatment so they get to know you. And then after that, you come to the group. And there's a bunch of lazy boys or other comfortable chairs, recliners in this room. And the acupuncturist will check in with you, what's better, what's the same, what's worse. And then the same thing, prep the area with alcohol, insert the needles, leave you to rest, take the needles out. And then in group acupuncture, the fee is typically a sliding scale. What I've seen most often is between $15 to $40 or $50 per session. So that is much more affordable than the $60 to $130 per session, and often makes it much more feasible for people to go at the interval that they feel they need or that their acupuncturist recommends. Now, of course, the million-dollar question, how many treatments do I need? Well, that is to be determined. As you're going through your days, weeks, months of receiving acupuncture care, you're going to know, oh, wow, I feel so much better, or gosh, I don't feel any different at all. You'll know if it's working for you, for one. And your acupuncturist will let you know, oh yeah, I think you're doing enough better that we can make the interval of treatment less frequent. My goal as an acupuncturist is to always work myself out of a job, so to speak. I want my patients to be well and vigorous and healthy, so they don't need to come twice a week for the rest of their lives, but maybe they choose to come once a month for tune-ups, for stress management, things like that. The other rule of thumb that I use is that somewhere between 4 to 6 treatments, and that's whether you're coming twice a week or once a week, but after about 4 to 6 treatments, both you as the patient and I as the acupuncturist will be very clear. Either, yep, this person's really seeing some improvement, their headaches are less severe, they're less frequent, or maybe if it's a woman, she's actually had a period without a migraine, things like that. Then we know, yes, we are on the right path and can determine again when to scale down the frequency of the treatments. Conversely, I've definitely had patients who after 4 to 6 treatments, both them and I are like, huh, really nothing's changed. This is kind of puzzling. So then for me as the clinician, I always triple check my differential diagnosis. I try to think outside the box and make sure, have I missed something? What am I not taking into account? Is there a different way I can think about this patient's presentation and change their treatment and treatment plan, in which case I do. And in the other cases, I'll let my patients know, gosh, this is just not helping you at the interval and the amount that I would expect. Let me refer you to my colleague. Maybe it will be a better treatment with her or him thinking about your case. Maybe they'll have a different way of looking at your presentation. Or maybe I need to refer you back to your primary care provider. Maybe there's labs that are needed or what have you. But never, ever would I say, oh, just keep going to acupuncture for months and months and months and months on end without any intervention that's really demonstrating improvement. No, you should see improvement. It's incremental, slow but steady. I often joke that acupuncture medicine is like the tortoise and the rabbit. It is not rabbit medicine. That's biomedicine, right? You take an ibuprofen and your pain gets better. You can tell with one treatment, that one dose of ibuprofen, things have changed. With acupuncture, sometimes that happens, but not so often. Usually it's, again, like the hare. It's just, the tortoise. It's like slow and steady improvement that is consistent and stays. And so like we saw in that one paper, they followed folks 5 months after the cessation of treatment and their migraines were still better. Which is another question that I'm often asked. Well, gosh, if I stop acupuncture, will the benefits go away too? No, they won't. There might be some resurgence. It depends on your presentation and what's going on, but it's not as if, once you stop acupuncture that the intervention stops working. It's not that at all. So thank you for your attention. It's been a real pleasure to speak with you regarding acupuncture for headache. I'm just going to quickly zip back to the very beginning of my slides where my email address is. And anyone and everyone, you're welcome to email me if you have questions. And that is at lisa.taylor-swanson@nurse. It's the word nurse without the E at the end, .utah.edu. Thank you and good night.